A doctor has warned of the types of silent killer cancers and their early warning signs that could be easily missed. Many individuals may not contact their GP when displaying such symptoms, which could be severe enough to require medical attention. But this can be worse in the long run, as ignoring them could allow the disease to progress. As such, this gives the cancer the chance to grow and makes treatment even more difficult. They can also overlap with less serious conditions, adding to the idea that people don't need their doctor to see to them. The term silent killer is used to describe cancers that sometimes don't cause any noticeable early symptoms, Liverpool Echo reports. Cancers that can remain hidden until they develop include bowel, cervical, liver, lung, ovarian, prostate and pancreatic cancer. To help people identify when they should seek help, Dr. Ahmed El-Moder, consultant oncologist at Spire Little Aston Hospital, has shared 7 examples and the risk factors behind them. Here's what you should know about 7 types of cancer and their warning signs. 1. Bowel cancer. This is one of the most common cancer types in the UK, according to the NHS, mostly affecting those over the age of 60. Common symptoms include persistent abdominal pain, bloating, cramps and changes in your bowel habits, e.g. constipation, diarrhea or thinner stools. You may also notice blood in your stools, have the urge to open your bowels even after recently passing stools, and unintentionally lose weight. Age is one of the biggest risk factors, but you should also take into account family history and habits like smoking and drinking. 2. Cervical cancer. Cervical cancer is a cancer that's found anywhere in the cervix. It grows very slowly and can often be detected through a cervical screening test. Common symptoms include vaginal bleeding in between your periods, during or after sex and after menopause, heavier periods, changes to your vaginal discharge, pain during sex and pain in your lower back, lower abdomen and pelvic area. According to Dr. El-Moder, cervical cancer is more common in those aged under 45 and those with a weakened immune system, for example, due to HIV or AIDS. Your risk of cervical cancer is also higher if you've given birth to children before age 17, had multiple births, have not been vaccinated against HPV or previously had bladder, kidney, vaginal or vulval cancer. 3. Liver cancer. This is found anywhere in the liver, and the danger depends on where it's found and how big it is. A lot of the symptoms relate to digestive issues such as nausea, vomiting, paler stools, darker urine and feeling full after eating only a small amount of food. You may notice a lump on the top right side of your abdomen, feel pain in this area, and experience abdominal swelling that isn't caused by eating. Other symptoms include jaundice, where the whites of your eyes become yellow, pain in your right shoulder, unintentional weight loss, loss of appetite, fatigue, fever and feeling unwell. You're more at risk of developing this cancer if you are male, have a family history, are aged over 60 or if you have diabetes, hepatitis or liver flukes. 4. Lung cancer. This is a very serious yet common form of cancer, with more than 43,000 people in the UK being diagnosed each year. Symptoms include a persistent cough, breathlessness when performing activities that usually aren't a strain, coughing up blood, fatigue, loss of appetite, pain in your chest or shoulders, repeated or persistent chest infections, and unintentional weight loss. Smoking puts you at a bigger risk of developing this cancer, as well as toxic chemicals like asbestos, arsenic and coal fumes, and exposure to high levels of radon gas. 5. Ovarian cancer. Ovarian cancer mostly affects those over the age of 50, but anyone with ovaries can be diagnosed with it. A lot of the symptoms are similar to that of a period, including abdominal bloating, back pain, fatigue and persistent pain or tenderness in your pelvic area. Other symptoms include constipation, diarrhea, loss of appetite, feeling full after eating only a small amount, unintentional weight loss, sudden urges to urinate and urinating more often. The risk of developing ovarian cancer gets bigger as you age, but also with a family history, have endometriosis or diabetes and have never used any hormonal contraception. Join the Daily Record WhatsApp community. Get the latest news sent straight to your messages by joining our WhatsApp community today. You'll receive daily updates on breaking news as well as the top headlines across Scotland. No one will be able to see who is signed up and no one can send messages except the Daily Record team. All you have to do is click here if you're on mobile, select Join Community and you're in. If you're on a desktop, simply scan the QR code above with your phone and click Join Community. We also treat our community members to special offers, promotions, and adverts from us and our partners. If you don't like our community, you can check out anytime you like. To leave our community, click on the name at the top of your screen and choose Exit Group. If you're curious, you can read our privacy notice. 6. Pancreatic cancer. This cancer affects the pancreas and symptoms include bloating, changes in your stools, constipation, diarrhea, nausea and vomiting. You may also experience back pain and pain in your upper abdomen, which feel better when you lean forward and worse when you lie down or eat. Other symptoms include jaundice, where the whites of your eyes become yellow, unintentional weight loss, loss of appetite, fever and fatigue. You may be more likely to get pancreatic cancer if you are over the age of 75 or have a family history. Certain medical conditions also increase your risk, including chronic pancreatitis, diabetes, gallstones and metabolic syndrome. 7. Prostate cancer. Prostate cancer usually develops slowly, so there may be no signs for many years. Symptoms of prostate cancer usually only occur once the tumor is large enough to press against the urethra. Symptoms include difficulty urinating, needing to urinate more often and the sensation that your bladder is not completely empty even after urinating. Your risk of prostate cancer increases with age, and if you are overweight or obese, or have a close relative who had prostate cancer. Your risk is also increased due to ethnicity as well as diet. Don't miss the latest news from around Scotland and beyond. Sign up to our daily newsletter here.